everyone, this is Dr. Teymoorian here at Harvard Eye Associates. I'm a cataract and interventional glaucoma specialist, and you're tuning in because you're thinking about having cataract surgery. I hope this video and the series of videos helps you, number one, be better educated with what exactly a cataract is, and number two, what to anticipate with the surgery. So with that in mind, let's go ahead and get started. But before I do that, I want to take a time just to step back and say thank you for allowing us to take part in your care. We seriously do value your trust in guiding you in your cataract journey. So thank you for allowing us to do that. All right, well, let's get to it. So you're having cataracts or you're thinking about cataract surgery. What are some things you need to know so you can better educate yourself so we can get the best outcome ever? Now, when we talk about cataract surgery, our goal is to strive to get you to 20 happy. 20 happy is something different for every patient. So really what we want to do is individualize our care for what's most important to you. And for you to be able to do that, you have to be able to work with us so we can figure out what exactly that is. So let's take a step back and actually talk about what exactly is going on in the eye with the cataract, what are some symptoms, and what exactly is the surgery. So the best way to think about the eye is to think about a camera. The camera in your eye has what we like to call a lens. The lens is what actually allows the light that's coming in through your eye to land in one spot in the back of your eye. The issue with the cataract here is you're getting older, instead of it being a nice, clear, transparent structure, it gets cloudier as you go. And this is a normal change of age, or as we like to say, maturity here in the office. Now that can present in several different ways for our patients. Some patients may say, gosh, when I'm trying to drive at nighttime, the oncoming headlights have a lot of glare halos. Or even if I'm trying to read and I'm cranking up that light, I have a hard time reading. Some patients just simply say, I just have a hard time seeing overall. And there are some patients who actually don't notice much, but their cataracts are getting worse. And once they actually come out, they realize, gosh, I really wasn't seeing all that well. How we decide when to do cataract surgery, really it's a combination of the symptoms that you're having, along with the clinical exam we do here in the office. But hopefully once we get past those things, we can then decide, are you appropriate for cataract surgery? And if you are, we move forward with it. Now, cataract is a natural aging of the eye, like I mentioned before. So what that means here is a lot of people have cataract surgery. In fact, because everybody has two eyes, cataract surgery is the most common surgery done in the United States because we all get them as we get older and we all get two of them. The good news for that, when a surgery is common, we run things pretty efficiently. It's usually a 10 to 15 minute outpatient procedure. You should expect to be at the surgery center for about 2 hours. Most people get one eye done at a time, with the second eye being done about a week or two later, depending on how the first one is healing. Probably the most important question that I get is, will I be comfortable? And I promise you, before we get started, you'll definitely be comfortable. We have a full-time anesthesiologist that we work hand in hand in that will get you comfortable before we start. In fact, we can't even start until we want to make sure that you're comfortable because we're working in such a small place. Probably the other question that I get a lot of is cataract surgery, are these like tires of an eye where after so many miles we're going to have to redo them again? The answer to you is no. Once your cataracts are gone, they're gone forever. Now, it's not uncommon though over a period of time, whether it be days to years later, to develop a little scar tissue behind your new lens, and that can interfere with your ability and create some diminished vision. If that does occur, it's something that we'll notice here in the office, and there's a way of addressing it with a light laser polishing procedure that's just done in the office. But in terms of a cataract coming back again, it's a one-time only procedure. So those are basically the symptoms of cataracts and the basics of cataract surgery. In the next segment of videos, we'll talk about different lens options you can pick because as you can imagine, your cataract is the natural lens of your eye. If we remove that, we have to put a new lens in. And what are your options for the surgery itself moving forward? One thing I do want to note here is this is meant to be just a preliminary primer to surgery itself. Should you have any questions, please feel free to reach out to one of our surgical coordinators or to one of our doctors here. We're happy to work with you. The most important thing that I like to stress to my patients is the time to talk about surgery is always before surgery. Let's you and I get on the same page before we do anything. That way we know exactly what we're doing and we effectively get it done. Thank you and stay tuned for the next videos.